So let's begin. So I'm a 7th-year medical student in UISS. I'm deeply passionate about medicine and dedicated to helping others. So this is just a small introduction about me so that you can know more about me. I'm a member at Les Randonneurs and I'm former president of the Office of Sports, Arts and Associations at my university. Also, I have several certificates. So now let's begin the presentation. So are you ready to dive into today's case? You can just write whatever you want. I guess by now you have access to the application, so you can just type whatever you want. Okay. Okay, so happy that all of you are ready. Let's begin. Okay, so this is our first case. We have a 63 years old patient who consults for mastodenia. On clinical examination, we see a nodule in the upper outer quadrant of the left breast with skin retraction. So I will let you 5 seconds to reread this text because we will be having some questions for this case. So read it carefully. You can screenshot it if you want to. And I can tell you the question from now so you can think of it. So which radiological examination will you request in this case? So it's a 63 years old patient who consults for mastodenia. Okay. Okay, now we will go to the question. You can now enter your name, whatever name you want to enter, and then you'll be shown here. So now we have 4 players. So just enter, type menti.com and then the code, and then enter a name so that you can be here with the other players and have a chance to win. So I will wait 5 more seconds so that you can just all join us. Okay. So now there is 7 players. For the other ones who want to join, they can just type menti.com and then enter the code. And then there will be a place where you can write your name or your pseudonym. Then you will be here with the other players and you will have a chance to win this competition. Well, for Amal and Siham, I salute you for your... I can't tell you if it's right or wrong, and I'll be happy if you can join the other players so that you can choose your answer and have a chance to win. Okay. So now we will begin. Yes. I'll count down to 5 and then we'll begin. 5, 4, 3, 2, and 1. Okay. So answer fast to get more points. Which radiological examination do you request? Is it breast ultrasound, mammography plus breast ultrasound, breast MRI, breast CT scan? So choose your answer. You have 15 seconds. Okay. So yeah, the right answer was mammography plus breast ultrasound. Okay. Let's see. Well, now Asma and Milu are the first one. Okay. So, which radiological examination do you request for this 63 years old lady who has nodule in the upper outer quadrant of the left breast plus skin retraction? So, breast ultrasound alone is not indicated as it's indicated for younger patients under 30 years old. Those are the justifications for each answer so that you can know more about it. The mammography, yes, it is to be complemented by a breast ultrasound. For the breast MRI, no, because it's not a first line examination, and the breast CT scan, also it's a no, as it's irradiating examination and it's not suitable for this case. Now the second question. Okay, so now we have 9 players. Let's see the question. So answer fast to get more points. Which of the following clinical signs justifies asking for a diagnostic mammogram or ultrasound? Is it a palpation of a breast mass? Is it a single pore nipple discharge? Is it a nipple eczema, Paget's disease, or all of them? Okay. The answer was all of them because all of these signs will indicate that you need to do a mammogram or an ultrasound for your patients. Okay, now let's see the points. Okay, now Milu and Uam and Ned was the first one to answer. Okay. Milu was the fattest one. So now the answer. Which of the following clinical signs is the most appropriate indication for requesting a diagnostic mammography and or breast ultrasound? So all of these signs indicate requesting a diagnostic mammography and a breast ultrasound. So these signs are palpation of a breast mass, changes in the skin, including redness, orange peel skin or retraction, also nipple eczema, which is Paget disease, and we have also nipple retraction, single pore nipple discharge, and palpation of an axillary lymphadenopathy. Now let's see. This is just a small recap about Paget disease because I think most of us just forget about it or don't know about it. So this is from Med Rewind. For Paget disease, it's a rare disease. So these are the signs. So there's a redness, scaling, and flaking of nipple, and also sometimes there's an underlying invasive ductal carcinoma. It's a superficial lesion of nipple or areola. Okay, so now let's go to the next question. Do you know the difference between a screening mammography and a diagnostic mammography? This is not a question that will be noted, of course, but it's important to know if you know about it or not. Okay. Nice. Okay, so now let's see what's the difference between the two. So we have a diagnostic mammography and a screening mammography. For those who know the difference, it's a good thing because you will know, inshallah, how to answer for the next questions. For those who doesn't know the difference, pay attention in this definition so that you can answer the upcoming questions. So diagnostic mammography is requested in the presence of a clinical sign. And the screening mammography is requested without a clinical sign. So starting the age of 45 or 50, they have to do a screening mammography every 2 years. Okay, so now let's see the other one. If you want, you can screenshot this one so it can help you to answer the upcoming questions. Okay, now let's go to the question. So this is our next case. It's a 54-year-old woman with no personal or family history of breast cancer and no current breast symptoms. is considering her next step for breast cancer surveillance. So pay attention to this case. So which type of mammography is most appropriate for her? Now let's go to the question. Okay. Now we have the question. Which type of mammography is most appropriate for this patient? Diagnostic mammography due to her age, screening mammography because she has no symptoms, diagnostic mammography because of her family history, screening due to specific clinical signs, or diagnostic mammography. Well, this was a little bit of hard question. Yeah, it's screening mammography because she has no symptoms. As we said, screening mammography is when there is no clinical sign. So this patient, we can re-see it. This patient has no clinical sign, as we can see. So she has no personal or family history and no current breast symptoms. She's just considering what to do for her surveillance. So the best thing is to do a screening mammography. Oh yeah, that was the answer. That's good. Let's see the leaderboard. Okay, now Ronald and William was the first one, but Melu still is the first and the fastest one. Okay, let's go to the next case. So here we have a 42-year-old woman who presents to the clinic with a palpable lump in her left breast that she discovered 1 month ago. She has no family history of breast cancer. So pay attention to this case. We'll be having the same question. What is the most appropriate initial mammographic examination for her? Screening mammography or diagnostic mammography, and why? So she has a palpable lump in her left breast and she has no family history of breast cancer. Okay, now the question. Where is our ninth player? So for those who log out, they can just re-enter menti.com and then type the code, and then they will be redirected to the question. Okay, so now let's begin. What is the most appropriate initial mammographic examination for her? So read it and try to figure out the answer. Okay. Well, that's good. Yeah. It's a diagnostic mammography due to the presence of a clinical sign. We can see it here. We said she has a palpable lump in her left breast that she had discovered 1 month ago. So this is a sign. This is a clear sign. So she need a diagnostic mammography. That was good. Let's see the leaderboard. Okay. That's good. I just did the last one. Okay, so there is 9 players. There's other questions. Okay, now let's go to the next question. So answer fast and answer the right question. When it is appropriate to perform a mammogram without an ultrasound? Always for any breast type, never, or only in dense breasts, or is it based on breast density? Okay. Yeah, it is based on breast density. Okay, so now we am is the first one. And second one is Milu, and then there's mammography. Well, the correct answer was based on breast density because ultrasounds complement mammograms, especially in dense breasts. So, a mammogram without an ultrasound. In the diagnostic context, ultrasound is indicated because there are lesions that are visible on ultrasound, but not in mammography, especially when the breasts are dense. So, in the diagnostic context, a mammogram plus ultrasounds are complementary. But in the context of screening, because we talked about diagnostic mammogram and screening mammogram. So for the screening one, it's based on breast density. So if there is dense breast, so if the breasts are dense, an ultrasound is required. But if there is fatty breasts, so in this case, the ultrasound is optional. So that's why we said that it depends on breast density. You can screenshot this if it will be useful for you in the future. Now we'll go into the next one. This is just to show you more the breast density in mammogram. So on the mammographic report, breast density is classified into 4 categories. There is a homogeneously fatty, B scattered fibroglandular tissue, and C heterogeneously dense, and D extremely dense. So you can see the difference here. So you can see here is all white, but here is white and black. Okay, so now let's go to the next one. So now we have the next question. So now we have just 2 questions left. This is the can breast ultrasound replace mammography? Is it yes or no? Yeah. Can breast ultrasound replace mammography? No, it cannot. Okay, let's see the leaderboard. So now Rania was the first one to replay, and Mehdi also was the first one. Okay, but Milu still has the first place. So, can ultrasound replace mammography? No. Mammography can detect certain abnormalities like here, microcalcification and distortion, like this. It's like, so this is a distortions and opacities like here. Here there is an opacity and also microcalcification inside of the opacity. So all of this can be shown more clearly in mammography than the ultrasound. That's why mammography is so important to do. Now, our last question. Okay. What describes the mammography radiation dose? Is the mammography radiation dose high, risky, minimal safe, variable, or like a CT scan? Yes, that was right. It is minimal and safe. No, it's not high and risky. It's not variable. It's not like a CT scan. It's minimal and safe. We will see why. Okay, so now mammography and Mehdi was the first one to answer. Okay, mammography was the first one with 40704 Ps. Okay. Now we will see mammography and radiation dose. So here you can see a table that shows the radiation dose uh, of the of mammography, CT scans, MRI, and all of the examinations that can be done. So here you can see mammography, it's 0.4, and for the CT scan, chest, it's 7. So there's a big difference between 7 and 0.4. You can see it here more clearly for computed tomography and mammography. So this is an example of a comparison between the dose received after mammography and the dose received after a chest CT scan. So one CT scan equal to 17.5 mammographies. So the mammography is safe and the radiation dose received is minimal during mammography. So keep this in mind. Why getting checked for breast cancer matters. Every year, 50,000 people find out they have breast cancer. It could happen to 1 out of 8 women, and early detection allows for a cure rate of 90%. So it's so important to advise women around us to get checked. So our take-home message of today is that you can save lives by talking about breast cancer. It's a big way to help keep the women we care about safe. Starting at 15, a quick mammogram every 2 years can make a huge difference. So make sure to advise the women who are close to you. Also, don't forget that it can also be found in men. Yes, it's rare, but still it can be found in men, so be careful. So as we conclude, I want to extend my heartfelt gratitude to 2 remarkable mentors who have greatly enriched this presentation with their wisdom and expertise. It's Dr. Nadia Skhali, who is a pillar of knowledge and inspiration, especially in breast cancer, in breast radiology. And also Dr. Asma Asqali, who is really a really good radiologist in traumatology and neurology, related to radiology, of course. And this is the form that I will share with you so that you can give me your requests to do better presentations for all of you. And if you have anything to say, you can say it in the feedback that I will share with you. And we'll end with a quote: "The future belongs to those who believe in the beauty of their dreams." I hope all of you keep dreaming, keep striving for more, and keep working for more, of course, to obtain it. I'm really grateful for your attention, and you've been awesome. Thank you.